This way? Is that the right way? Isn't it supposed to be this way?
I thought that you guys wanted it this way now.
It was that Facebook was sideways.
We are live.
The way we did it last time.
We're live.
This way will make Facebook the right way, but then
Instagram
the wrong way. And I think we have more followers on Instagram.
Okay, then I can... Wow, we have 3 viewers.
All right.
Of course we do.
But now people are cut out. So I can just hold it over here, I guess?
It takes a steady hand. You got it.
Yeah, there you go.
So you guys, welcome. We haven't done a Kicking It with Kerry for too long now. And we had a little break in the schedule. And so we decided, let's get to talking. Okay, so here with me today, I of course have Dr. McNeil, fan favorite of the show. And then we got 2 new guys over here. We've got Alex and Cole, okay? Alex and Cole I brought in to join this discussion because we want to talk about guy stuff, right? I think sometimes the guys get lost in the mix a little bit, and that just shouldn't be how it is, right?
Yeah.
And you guys have questions too about things we do here. I know you
We
guys...
have 3 male viewers right now.
All right,
Perfect,
yay
perfect.
for the males.
What's going on, guys?
What's going on? Look at Alex. He's natural. So we've got questions, right? So like, for example, when you guys first started here, when you thought of a dermatologist, and I was in an elevator with a man the other day, I said, "Oh, are you going to 7th floor?" He's like, "Yeah, I'm going to see the cosmetologist." I was like, "Hope you don't say that to the dermatologist, because that could be offensive." They're not cosmetologists, right? They go to school for just a minute, right?
Yeah.
Dr. McNeil, how long do you go to school to get your MD and then to become a dermatologist? How long does that take?
To be a board certified dermatologist, you would do your undergraduate degree and then medical school for 4 years, and then 4 years of residency, 1 year of medicine and 3 years of dermatology. And you're right, many dermatologists would be offended by being referred to as a cosmetologist. I'm not, because I remember when I had been accepted into medical school, but I hadn't started medical school, and I didn't know that a dermatologist was a physician. So it was told to me by a dermatologist. So I understand that not everybody knows that, and it doesn't offend me. It's an opportunity for education. That's what we're doing right here.
That's what we're doing. So when you guys think of a dermatologist now, you obviously have a different, perspective. But let's say 5 years ago, you're just a regular guy on the street, just a regular Joe, Cole, Alex.
Mm-hmm.
What did you think a dermatologist did, and what have you learned that has shocked you the most about what we do here, or what you might be interested in?
So I thought it was really just for like people that had acne and like psoriasis. Those are the only 2 reasons I ever went to a dermatologist. And now that I'm here, I see that there's a ton of different cosmetic procedures that everybody gets to do, like dealing with hyperpigmentation, lightening of the skin, Botox. Like the cosmetic stuff was just a whole different world that I had no idea went on within a dermatology practice.
Really?
Yeah.
What interests you the most about, like, what would you be most inclined to want to try? Or what do you think guys are afraid of? Or
I think a lot of guys are a little bit afraid of the whole laser hair removal thing.
ouch.
Yeah.
Yeah.
And I don't know why that is, because I've heard that it's like not a super painful procedure whatsoever. And if you're like me and you're a little bit of a wolf man, it can be kind of nice to have the pressure of shaving your back taken off of you.
Right. Absolutely. So, but you knew laser hair removal existed.
Yeah, I just thought you went to like a laser hair removal office.
Which you can. You could do that, for sure. Some of the benefits of coming here would be that it's overseen by a board-certified dermatologist.
Right.
And there can be some serious, like problems with laser hair removal. I'll let Dr. McNeil answer, but,
Yeah, we have 3 different types of lasers that do laser hair removal. So the device that you choose depends a lot on your skin type and the types of hair. So it's good to go somewhere that has lots of devices, not just like a one-trick pony that uses the same thing for everyone. And then, there's risks associated with it, right? So you need to make sure that the person doing the procedure and the office can deliver the right procedure to you. And then, if there is a complication, that they know how to manage it. There's places that'll do procedures, but they don't know how to manage their own complications. And so So you need to see someone who can really just take care of you and do what's best for you.
And a complication could be
You could get a burn from laser hair removal.
Ouch.
It could leave a pigmentary change. It could leave a darker spot where it was done. Generally, those are things that would be done, that would happen if it was done improperly, or they didn't screen you properly to make sure you're a good candidate for the procedure. But, you know, these things can happen.
So it's good to come to us. We'll just put it out there. I mean,
Yeah.
we'll take care of the hair. We'll take care of treating you properly. So, Cole, what about you? What's something that you have an interest in after working here, or you had no idea that we did?
I definitely had no like real background in skincare products. I would say, like coming in when I saw the kind of entrance wall with all of our nice products that we sell, I was kind of intimidated because I was like, I don't know what any of that is, and I didn't know. I even remember asking in my interview, like, will I be okay working here with not knowing any of this stuff? Like, if some lady asked me about a face wash, like I didn't know anything, you know?
Yeah.
And now I have like a full face kind of routine that I do, so it's like, it's definitely something that guys can get into and should get into, because I think like in the last year my skin is like totally kind of revived and like improved, and it's like bettered my health even. I didn't even know that was like dermatology at all. I was just like, thought that was like women's health that they did for themselves, you know?
I love hearing that. So you think that your skin has improved since you've worked here just from using products?
Oh yeah, definitely, for sure. Just like actually having a good routine and taking care of my skin on a daily routine in a more like thought out process has actually helped my skin. And I didn't even think I had like that many blemishes or like problems with my skin before, but it's like a noticeable difference. I'm like, wow, actually I feel like more refreshed in the day, like I look better, brighter, kind of more awake.
I like that.
Yeah.
Can I ask what you do?
Yeah, I definitely. So every day I have like a morning face wash that I use. I use like the MD McNeil
Dr. McNeil's antioxidant one?
Yeah,
Yep.
face cleanser, and
That's
then
a
I
good
put
one.
on a moisturizer. I do like the well, I have a different moisturizer that my mom recommended.
It's okay. You can.
I know. And then I do sunscreen after that. It's just 3 simple things. It's really easy. And then I just do the 2 at night. I do a face wash and then moisturize at night before bed. It's super simple, but it's made a huge improvement. And it's something I didn't even know of, you know.
Yeah, and you're so, I mean, I don't know exactly how old you are, but being at the age that you're at and starting sunscreen and sun protection now is like one of the very best things you can do for yourself, like, moving forward. Dr. McNeil, do you have any, like, input on what you think most men should do if they're not doing?
Yeah, obviously we can give sort of more tailored responses to that questions during a consultation, but in general, a gentle cleanser for morning and the evening, sunscreen every day on the sun exposed areas are the 2 most important things.
Mm-hmm. And Cole, do you know which sunscreen you're using?
I use one of the I don't know the number.
Ulta MD UV
Yes.
Clear?
Yeah, I want to say it's one of the ones you recommended, so I'm sure it's probably that.
Well, I only say that one because generally speaking, when a gentleman comes in and they ask me for a recommendation, I will usually say Ulta UV Clear, mostly because men are very particular about texture and look, and it feels really nice on the skin, and it does go on clear.
Yeah.
Since I've been working up front, we've changed sort of the format of the office. I used to be kind of right in the product store, and now I don't get to make recommendations to patients as often, but we have added a new product called the Isden line, and that one might be the one I would also recommend too, because it does go on, it has a really nice texture, and it also can help heal the skin and then protect too.
Yeah, definitely.
So, and what about treatments?
Treatments, I've actually done a microneedling treatment twice here, which was sounds kind of intense or something like that, but it's really not, or it sounds kind of like a facial type thing, but it was really actually kind of reviving, and it like evened my whole skin layer. It felt like I didn't realize that I had like uneven skin, and then afterwards it just felt like my forehead was like one plate. And that was really kind of something I was like, oh, I didn't think I even, needed or something like that. But it was like, that's cool.
Did you just do that once?
I did it twice, and I want to do it again because each time it seems to get better. So why not, right?
Did I pay you to say any of this?
No, you didn't. You didn't. No, this is just.
Are you worried about job security
Not
right
at all.
now? So
No, I'm just actually getting good skin care routine out of the fact that I work here. And it's
Yeah.
nice. It's a double benefit.
It is nice. So let's say you go on to become, a doctor, or you leave medicine altogether and you're, in the stock market. Do you think you would continue to do
Oh, yeah,
like these
definitely.
these regimens? Or are you only doing them because you work here?
No, I think that it's something that I picked up because I worked here, but it's
Mm-hmm.
so easy that it's something that I'll take on forever, and I'll try and implement it, for the next however many years I'm alive, hopefully.
Yeah.
It's so simple that it's something that it's like, why not keep doing it? And it's obviously helping, so there's no reason not to, and it's healthy, so.
And your guy friends, your bros, what are they learning from you too, or
Yeah,
are they curious about things in this office other than all the beautiful women that work here?
Yeah.
Oh yeah, absolutely. So my younger brother's a little bit vain, but he has no idea what to do for skincare. Like, he washes his face with shampoo.
Aw, that's
And
so cute.
lucky for him, he has just amazing skin, so no matter what he does, it looks decent, but he's tired of being oily. He's got some acne scarring on his face, so I've talked to him about the microneedling for acne scarring to sort of even out his face, and I've talked to him about some of the face washes that we have here, like the antioxidant cleanser that Cole was talking about, to sort of reduce the oiliness, and he's looked at some of the lightweight moisturizers we have, like the Intensive Repair Night Cream. I feel like that's a really solid one.
What about dads?
Oh, my dad is insufferable. He will not do anything for his skin. But he has pretty bad dandruff, like seborrheic dermatitis of the scalp. So I've gotten him onto ketoconazole shampoo, and my mom has thanked me a lot for that.
Aw, that's so nice. Happy Mother's Day, Mom.
Happy Mother's Day, Mom.
I got Dad some dandruff shampoo. Cole, what about your family?
I wouldn't say necessarily cosmology wise. My dad hasn't really picked up on that as much. I've tried. I've definitely pushed it, but he's also stubborn in that way. But one thing that's been great is that he actually had a spot on his back, and he was like, "Oh, I always itch this spot," and I was like, "You should go get that looked at." And it ended up being a cancerous spot, and he ended up having a Mohs seed surgery. So
wow.
it's
Wow.
kind of, it's been good that he to get looked at and to get screened and stuff like that. I don't think.
Do you think he would not have done that?
I think he might have, but maybe not. He wouldn't have definitely thought skin cancer. He would have just thought, I have an itch on my back, I'm going to itch my back. And I was like, well, maybe take it a step further, And he didn't. And he was like, oh, I didn't even think about that. I was like, you should.
Yeah.
He's up at that age, he's getting a little older, so it was kind of around the time. I was like, yeah, maybe you should get a skin check. And so now he's every 6 months. So.
Well, if we have anybody watching, we're open to taking any of your questions. Please, let us know if you have questions. I find this very interesting because, we didn't prepare for this, this talk, and the things that you're saying about skincare is not where I thought the direction of this conversation would go. To be honest with you, I kind of thought you might be more interested in more of sort of the I'll call them crazy things, but I'm thinking how you might think of them. I don't think they're crazy because I do it all the time, but fillers or Botox or things like that. What do you think men in general should be more open to trying? And no pressure. I want your honest answers. Where do you think they might benefit that they're overlooking?
I think that moisturizing is something that men don't do to their legs because they don't shave their legs, and if you're like me, you have hairy legs, and it's kind of hard to rub that stuff in. But it has made me feel a lot better, especially whenever I'm going out and I'm wearing shorts and stuff like that. I don't feel like my legs look really ashy, and that's a nice feeling. Another thing, I had keratosis pilaris. I've had it for years and years and years, and I've always been using amlactin, and it did nothing.
Hold up, I got to interrupt you. He said keratosis pilaris, okay? And
yeah, I may have mispronounced that. I'm sorry.
No, you did great. You did great, but I'm just, you're throwing down some terms that some of these people probably don't have any idea what we're talking about. But those kind of rough patches, usually people get them on the back of their arms. They can be sort of bumps. So he's talking about that. So you had those. Now
I still have them.
On the arms, cheeks, and front of the thighs are the three most common areas.
Right. So I have it on my upper arms, and I had it on my forehead a little bit. I switched over to a glycolic acid lotion rather than using the lactic acid, and it made a huge difference. And then Dr. Lamer, the attending that I work for, she recommended azelaic acid, a little bit of tretinoin, so a retinoid, and it's lightened up a lot of the dark spots on my arm pretty substantially. And this is I've only worked here for a month, And it's more progress than I've made in my last like 2 or 3 years of actually addressing the issue, which is cool. I had no idea that I had more than one option.
I think what I take from what you're saying and what I want our viewers, our 3 guys out there listening, to take is like, there are certain things that you may live with and they might just be minor inconveniences, and you might kind of be like, oh, that's sort of annoying, or oh, I wish I could fix this, the ashiness on my legs. Generally speaking, these small things that you have that bother you on a daily basis are probably something that you could ask your board certified dermatologist about, one of our physician's assistants about, and get a very simple treatment that isn't going to cost thousands of dollars that can make you feel better about yourself. So that would be something I would just encourage you to do. Just take a second, ask the question about whatever it is, your clogged pores, or your breakouts, or your ashy legs, or whatever it is. Dandruff is such an easy thing. Switch up your shampoo. We might take a prescription.
Yeah.
There's lots of options that you can do that won't, break the bank, that can make your day-to-day life just much more comfortable, and make maybe the woman in your life a little happier that you don't have like, a snowstorm on your shoulder. Okay? Dr. McNeil, you've been working with men for years, men and women alike. They both come here. What's been kind of a surprising thing that you've had a patient deal with regularly that you were able to, fix with one appointment or 5 appointments? Like, what's the common thing that comes up a lot that you just wish you could loud speak to all the men out there that are watching?
Yeah. I think a lot of guys think that when they have, like, rashes are just, like, it's a rash, and so there's, like, one treatment for rashes, but there's so many different types of rashes with different causes and different treatments, and most of them are very treatable, that we can identify in one visit and give a treatment plan that they can just do, and it's totally, completely manageable. Mm-hmm. But they've just been, putting Neosporin, and it soothes it, and so they just keep doing Neosporin instead of the thing that can actually treat it. So, whether it's psoriasis or seborrheic dermatitis or eczema or all of these, the list is like hundreds of things. Just getting the proper diagnosis and the treatment it can go a long way towards sort of like what you're saying, like the keratosis pilaris you're fine with what you were doing, but Right. It was annoying, and there's lots of times we can just get these things under much better control. So that's it.
Rashes. There's more than one. That's the takeaway. And there's usually a very simple, treatment that we can figure out and get you feeling a lot better. Above and beyond these simple things, let's talk Botox.
Sure.
Yeah.
Would you ever have Botox?
I think I would do it in my armpits and on my forehead a little bit to keep me from sweating.
Okay, let's pause for a second. His armpits. So, did you all know that you can use Botox to treat hypohidrosis?
Hyperhidrosis.
Hypohidrosis is not sweating enough, and hyperhidrosis is too much sweating, excessive sweating. So we can use it for excessive sweating anywhere, palms and soles, axilla, face, scalp. But the most common areas are exactly what Alex said, the axilla. And then when we're treating facial wrinkles, a secondary benefit is less sweating in that area. Or we just do it for sweating only.
The more you know. So
it tends to last for a long time. Like, for example, when we're doing it for cosmetic use, the Botox will wear off in 3 to 4 months. But often, for example, when we treat the axilla, it'll last for a year. So it's pretty simple, straightforward to come in and get an underarm treatment. And generally, that will make you sweat a lot less for a year or close to a year.
Mm-hmm. So, Cole?
I'm a little bit more intense on it for, I guess, like, just personal reasons. I don't know. I just, don't know if I would get Botox in my face.
Yeah.
But if I were to do it, I would probably do it around the eyes. I think it's the most, like, of men that I've seen that come in to get Botox, it's the most unnoticeable, but does the most for them, where it seems to make them look the youngest and kind of open their eyes so you can see their eyes. But it's not something that I would be like, oh wow, he, like, you know, he looks, or he has the Botox look or something like that. So if I were to do it, yeah, it's very hideable actually. You wouldn't know that it's even there.
Do you think there's still a stigma for men getting Botox?
Yeah, I would say so.
Absolutely.
You
yeah.
would? Yeah.
Yeah.
I agree with you. I don't like to give men a completely frozen forehead look at all. I tend to treat men here and between the eyes also, because depending on their anatomy, some men get a super deep line or many lines there that can make them look kind of
Angry.
mad all the time.
Yeah.
So I like treating there also. But the eyes is where a lot of men will get a lot of crow's feet, and then that can, you know, make them look older than they are. And men and women like to look younger than they actually are. So it's a very natural look. Doesn't look like anything was done, but it wards off the wrinkles there in men and women.
What about filler for men, Dr. McNeil? Where do men get filler? And
Men get filler. They can get it anywhere, but the most common certainly is sort of the horizontal lines that develop on the lateral cheeks and the jawline to strengthen the jawline or chin. Use of filler in men has gone like that over the last couple of years. It lasts for a long time in these areas too, so generally that's a once a year treatment as well. Men like to not commit to every 3 to 4 months. And so often when I'm talking to a guy, it's like, well, how long is this going to last? I'm not going to come in all the time. So these are things that can last for a year. You know, filler along here and here.
can I just
strengthens
interrupt
the
really
jawline
quickly,
and
because I
just
worry
looks
that
masculine.
they don't know what we're talking about.
Okay.
Because Botox, I know a lot of women that don't know the difference between Botox and filler. And when I say Botox, there are several different types of toxins. If you've watched any of my other Kicking It With Kerry's, you know there's Xeomin, Jeuveau, Dysport, and Botox. They're all the same thing, which is really confusing. Not the same. They do the same thing, which is to help smooth out fine lines and wrinkles. Filler, on the other hand, fills volume loss. So or wrinkles, if you've got a deep wrinkle or if you have loss of volume, which tends to happen as we all age, it can fill up that loss. So when Dr. McNeil is talking about, you know, where she would put filler in men, you're saying, you know, you would fill up that volume in their nasolabial fold?
No, guys don't tend to get it here. They tend to get it more lateral in the cheeks. They'll often develop sort of a hollow in the cheeks that goes like this and then makes the neck kind of, you know, merge with the face. So if we fill here and then just the jawline right here makes this profile look just kind of, guys like it a little more strong than women do. So more masculine look. And
Me personally, I mean, when I look at aging men, I would say maybe the 3 most beneficial treatments for them that I've seen happen in our office. A lot of men get they've got like little pillowcases under their eyes, and then sometimes a deep, you know, like crevice. I think blepharoplasty is a simple surgery that really can make a marked improvement in men's appearance and how old and how tired they look. And it's something that Dr. Elstrom does quite often. And I would highly encourage you, if that's something that, you know, if you're looking out and you're seeing like, you know, this, you know, pillowcase of skin in your peripheral vision, you'd have a huge benefit from that. I've also seen men with like very like large double chins. There's several treatments that we can do that can help that are some are non-invasive and some are a little bit invasive, but again, a very easy, you know, procedure. Cool sculpting, Kybella. So that's 2. And I would say the third would be just overall like abdomen, like, you know, beer belly. We've been able to help men with that with True Sculpt and Cool Sculpting. So Dr. McNeil, do you have an opinion on like what you think are the best procedures for men, or did I get them all?
I think you hit them all. The other thing I might add is a lot of times when men come in, and their face is just like looking less even sort of than it used to, like Cole's commenting like how his face just looks more even from the microneedling. But a lot of times these fairer guys, as they get older, it's actually, they think that the guys think they have a rash, but it's actually little precancers and sort of sun damage on their face. And so we'll do, you know, a medical treatment that's a blue light or Effudex or one of these things for precancers. But cosmetically, they look a lot better afterwards because it made their skin look a lot more even. So, you know, it's healthy, you know, it decreases skin cancers, but also there's a cosmetic benefit from doing that. And so often that's a treatment that we'll recommend in the guys that are starting to get that sun damage.
I've done that procedure. There's a really good video on YouTube if you want to watch it. But
How many?
there's
views does
over
it have?
15,000. Let's get me to 16,000. Tell your friends. But on that same subject, the guys that come in that have, you know, those red, you know, cheeks or broken blood vessels, that's really common in fair-skinned men. And, you know, I don't think there's any avoiding it for some people, like at age, you know, 55 and up. And they can benefit from XLV. It's a laser, in and out, very little downtime, not that expensive, or IPL.
Yeah, rosacea, you know, is a skin condition that causes a lot of redness and broken capillaries, and you know, it can make someone look, you know, it's an unfortunate stereotype, but people think you're an alcoholic if you have rosacea, or you know, it's, you know, it's not caused by alcoholism, but people will associate it with that. So treating the rosacea can just sort of make a person look more healthy. It's purely cosmetic. It doesn't cause any medical problem, or it's not a consequence of any medical problem. But treating it with either the IPL or the XLV does generally make a person look sort of more healthy.
Less red. Are there any questions that we can answer? No. Okay, well, do you guys have anything that you feel like we glossed over or we missed that you kind of, like when you think about guy stuff, you kind of want to...
Male pattern baldness.
Okay.
Yeah.
Yes, you're hitting hard with the good stuff. Male pattern baldness.
When do we start treatment? That's a good question.
When do we ASAP. Get in. Okay, so Dr. McNeil, male pattern baldness. You know, we've got a 20-year-old watching, probably not. I mean, maybe some of the kids that were talking to me this weekend, they said they saw Kicking It with Kerry. So guys in their 20s starting to lose their hair, or guys in their 50s starting to lose their hair, what do we do?
So there's a male pattern hair loss. You know, the guys know that it's coming. They can see it, you know, in their family members. They can recognize a distinctive pattern, which often starts with just this kind of recession along the temples and then thinning in the back. The guys themselves might not notice the thinning in the back, but other people often aren't shy and will share it with them that they're starting to lose hair in the back. And, you know, once that progresses so that, you know, we've all seen it in older people where you can just see the shiny skin and there's really no hairs there at all, you know, really it's very hard to reverse. You could do hair transplant surgery, but even that is not going to replace it to how it was when you were younger. So it's all about prevention and jumping on it early when it starts in the 20s and early 30s. And there's topical treatments and there's oral treatments and there's injectable treatments. So generally if it's early, I'll start with just the topical. We get a compounded mixture of minoxidil, which is available over the counter, but it's a bit of a stronger version that will start people on. And often that'll work very well. It's just a solution that is prescribed and they can apply every night. And it'll, in 60 to 70% of guys, it'll at least allow them to keep what they have, if not grow back some hair. So it's very simple. But some guys won't apply something every night. They just won't do it. They don't like the feeling, or they just can't remember. So if the topicals don't work or they just can't do it, well, we can add an oral medication as well. Propecia has been FDA approved for male pattern hair loss for decades. And I think it's very safe. There are, you know, some cautions that we discuss with patients before we put put them on it, but I certainly would prescribe it for a loved one. I think it's very safe. I take a version of it myself for female pattern hair loss. So I think it's very safe. So those are the two most common treatments: topical prescription and then oral prescription. There's other things we can do along with that as well: oral supplements like Nutrafol, injectable treatments like PRP. So we discuss all these in consultation, but lots of things to do for hair loss. The key is to get it before it gets bad, because we can almost always help people to keep what they have, but it's very hard to reverse it without surgery, or if we reverse it, it's kind of like just a little bit.
I'm so glad that you brought that up, Alex. I think that you really helped out some people. So
My dad's losing hair, that's why.
okay, well, that's a good sign for you that he still has hair.
Yeah, he's 55, and it's just the front, like Dr. McNeil said, like right around here it's starting. He's gaining face. He's not losing hair.
Gaining face.
Yeah.
So you're gonna have him watch this?
Yes, I am.
You're
And
like,
I told
I'll
him
ask him to,
come
but he probably won't.
I told him to come in here. He's like, how do I grow my hair back? And I'm like, oh, we can try.
Yeah, good.
About a third of patients will be able to grow some back.
Oh, awesome.
But the rest generally will at least be able to keep what they have.
I think if it's that shiny, that's when it's kind of
That's
a
Yeah.
little
It's not coming
too
back.
late.
He's not quite shiny yet.
Okay, good.
Thank goodness.
Well, let's get him in.
Seriously.
Tell him.
So I really like what these guys brought up in general in this age group and 20s and 30s, for example. The kind of proactive things we can be doing is, clearing up any rashes, getting them on a good sunscreen and skincare regimen. Microneedling is very easy and can really clear up any acne scars, just blemishes, and be a little proactive with the anti-aging. And the laser hair removal, those are just like the super common things we want to get on in that age group. And then, beyond that age group is often when we'll start thinking about the Botox and other things in men. But, those are the hot topics in guys for sure.
We
for
covered
guys.
a lot of ground. Don't be intimidated by this conversation, guys. We'll tackle one thing at a time, but the first step is to come in and see us, okay? And how do you do that? You can, give us a call, 949-706-7886, or you can find us online and make an appointment online, okay?
And May is Skin Cancer Awareness Month, so you'll get your skin cancer check as well.
Yeah.
Ooh, I've got one more question for you, Dr. McNeil.
Oh,
How important is it for guys to dry their hair fully? Because almost every guy that I've lived with, and I've lived with dudes for the last 6 years, they just hop out of the shower and let their hair air dry. And then they get gnarly dandruff, they start losing their hair a little bit early. What are the consequences of
I
not
had
drying
no
your hair?
idea there was any point. I didn't know you're not. Well, okay. Let's hear this.
No, I think you can just let your hair dry now.
You sure? Okay.
Yeah, drying it
Are you
is
sure,
more-
dermatologist?
I don't
It's
know.
more of a styling thing.
Okay.
I don't think it increases dandruff or any rashes. Excessive drying can actually cause hair breakage.
Oh, really?
Because the heat does cause the hair to break. So
What about with a towel?
towels are fine because
Okay.
towels, absorb the moisture, so that'll help it to dry more quickly if you towel dry it. But I don't think it's important to blow dry it by any stretch.
Okay.
I actually thought it would be healthier not to blow dry it or
Yeah, 'cause
or treat it or do anything. And pulling and all of that I would think would make it come out easier.
It doesn't make it come out. Any hair that comes out, like when you're combing it or drying it, that means that it's in telogen phase and it's just going to shed anyway. You're not going to, unless you're literally ripping it hard. So, brushing is good and healthy. Most people think that promotes blood flow to the scalp and probably stimulates hair growth, if anything, to sort of brush through it regularly. Even though you might see hairs fall out, it's just because they're in that phase that all hairs go through and they're going to naturally shed anyway. So I think it's good to brush your hair. I think whether you let it air dry or blow dry or just dry on its own, I don't think that matters at all. except
Okay.
for styling issues.
There you have it.
There I have it.
There you have it. All right, guys. Well, we're going to wrap things up. I really appreciate you joining us. If you have any input or questions, you can make comments and we'll try and get back to you as soon as possible. Thanks again. Thanks, Dr. McNeil. Thank you, Cole. And thank you, Alex, for joining me today on Kicking It with Kerry. We'll see you next time.